Hello, welcome to ANA community. Today we are going to discuss some of the important aspect of general examination, that is examination of eye. What is the significance of doing the examination of eye and what might be the clinical implications? So how you are going to diagnose some of the diseases which are not only related to eye, other than the eye, some of the general clinical conditions that can be diagnosed just by looking into the person's eye. So we are going to have a little bit of few examples in this particular video. When you say about the examination of eye, as far as general examination is concerned, that is very, very important because whenever we start the communication, eye contact is the most important part. So whenever if a person is suffering from any of the general clinical conditions or the conditions related to eye, we can able to identify the abnormalities in the eye, maybe in the sclera or in the cornea or in the iris or in the pupil or in the medial canthus or lateral canthus area, etc. So here one such example, that is the being considered as the nystagmus. When you think about nystagmus, it is nothing but the involuntary movement of the eyeball. So in this particular image that is showing are the lateral or transverse movement of the eyeball, wherein the faster movement is present towards the left side and slower movement is present towards the right side. As far as our in the image is concerned, it will be in that particular way. So this may be present in cases of the cerebellar diseases or in case of semicircular canal diseases or the diseases of the inner ear, etc., etc. When you think about the normal eye, so this is what we are going to say. It is the eyebrow. Most of us know that. The next comes, it is the eyelids. Then comes, it is the eyelashes. Then here it is considered to be the sclerocorneal junction, and the white color of the eye, that is considered to be sclera, and the transparent portion, that is what we are going to see, that is cornea, and in the middle a small black colored circle, that is being termed as pupil, which is formed by iris. This is considered to be lateral canthus and this is considered to be medial canthus. Each of these are having its own clinical significance as such. So when you think about the eyebrows, etc., this may be absent in the person who are suffering from alopecia totalis. When you think about the kind of the yellow deposits, if they are present in these regions, that is being shown by the blue colored rectangle, that is indicative of xanthelasma. That is termed as xanthelasma, that is indicative of the presence of increased cholesterol in the body. When you are seeing the eyeball on the right side here, wherein the sclera is being observed on all the four sides, that is usually indicative of the exophthalmos, that means protruding eyeball, whereas the other one, that is indicative of normal eyeball. This is for the comparison. This particular image is for comparison. So when you are going to observe bilateral exophthalmos, this may be observed in cases of a thyrotoxicosis or hyperthyroidism. When you think about this is an image, so wherein there will be the absence of eyeball. On the here on the right side, the eyeball is being absent. When you think about this particular image, this is indicative of the growth of the conjunctiva, which is being observed from the medial canthus towards the cornea. If that is occluding the cornea, that is the pupil, then the person may have blindness. This particular hypertrophy of the conjunctiva, that is being termed as pterygium. Of course, this is present in the elderly people. And think about this is an image where the palpable conjunctiva is being visualized. That means both are visualized simultaneously. This is indicative of the pallor. When pallor is being present, this is indicative of anemia. That means the person will be having the less amount of hemoglobin in the body. This is an image where the person will be having the yellowish discoloration of the sclera. This is present in cases of the person who is having icterus or jaundice. If the person is having excessive hemolysis, or if the person is having the viral hepatitis or the diseases afflicting the liver or gallbladder or common bile duct, etc., the person may develop yellowish discoloration that is been termed as jaundice or icterus. This is indicative of a oculomotor neuropalsy, wherein the ptosis of the eyeball is being seen on the left side, wherein the right side that is normal. So that means when you see this, upper eyelid is a little bit occluding the, what do you say that, the pupil. This is an indication of oculomotor nerve palsy. When you say about sixth cranial nerve palsy, the person is having left the sixth cranial nerve palsy, wherein the movement towards the left lateral that is absent, whereas on the right lateral side it is very easily moving. So this is indicative of the cranial nerve paralysis, the to sixth cranial nerve palsy. This is an indication where the person is having inflammation of the eyes. See the redness observed in the conjunctival region, specifically on the left eye, more concentration, whereas on the right side it is somewhat less. Near the medial canthus, redness is being seen on the right side. This is an indication of cataract of the eye, where the pupil is seen like the white circle, that is indicative of cataract. This is indicative of arcus senilis, wherein we are going to see a white colored ring near the sclerocorneal junction. This is indicative of the age-related changes, or this may be indicative of the presence of excess cholesterol in the body. So like that, whenever if you see all the it's the different signs, that is indicative of some of the pathological changes that is happening inside the body. For example, in cases of the anemia, that is pallor, in case of icterus, etc., in case of the, what is it, xanthalisma, etc. So we are going to predict the possible pathological changes happening inside the body. So the take-home messages from today's discussion are: the eye is a very important organ for the communication. It is an important organ for general examination too. So it can be for each and every part of the eye. We can able to analyze the what might be the possible changes that's happening inside the body can be predicted. For example, absence of the eyebrows may indicate alopecia, that is the totalis or universalis. The presence of the the pallor in the palpable conjunctiva may indicate anemia, or icterus may indicate hepatobiliary dysfunction, etc. In community members, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one topic that you would like to hear in the coming days in this particular channel? Mention in the comment box below. And spread this particular video to maximum number of true Ayurveda learners or Nidana learners, so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.